Okay, so today's presentation is going to give you a brief overview of how Medicare works. There is just so much to know about Medicare, but today we're going to talk about eligibility for Medicare, when to enroll, what are your coverage options if you're on Medicare, and we're going to talk about some assistance programs that help lower Medicare costs. Before I get started, let me tell you a little bit more about the organization that I work for. It's called Center for Healthcare Rights, and we are a community organization, a nonprofit. We provide free help with Medicare and other related insurance. A lot of people who have Medicare also have other insurance like Medi-Cal, or sometimes they have an employer insurance. So we can also help answer questions about those other types of insurance.
İngilizce.
Hello?
Hello. Hi.
But our main focus is Medicare. And if you call our office for help, our services are free. We serve all of LA County. So as long as you live in LA County, you can give us a call. Our phone number is 1-800-824-0780. So that's an important phone number. Make sure you write it down, save it somewhere in case you ever have any problems or questions about Medicare. You can give us a call. Most of our funding comes from the California Department of Aging. They have a grant called Health Insurance Counseling and Advocacy Program. The abbreviation for that is HICAP. So we are the HICAP office for LA County. And again, all that means is that if you need help or have questions about your Medicare insurance, please call us for free help. So let's get started with the actual topic of today, which is Medicare. And we can't talk about Medicare without first explaining what is Medicare, right? So Medicare is a federal health insurance program. It provides health coverage to people who are age 65 and older. We also have some people who are on Medicare under age 65 if they have a permanent disability. But again, most people who are on Medicare are over age 65. One very important thing to know about Medicare is that your eligibility for Medicare is not based on your income or your resources. So it doesn't matter how rich you are, how much money you have in the bank. Medicare doesn't look at that when they're determining whether you are eligible for the program or not. Medicare is often confused with another program called Medi-Cal. And they're very different programs. Again, Medicare eligibility does not look at your income or how much money you have in the bank. Medi-Cal is an insurance program through the state of California. That's why it's called Medi-Cal, Cal for California. And the Medi-Cal program does look at your income and your assets. So for a lot of Medi-Cal programs, for people who are older adults, for people over age 65, they do look at your income. They look at how much money you have in the bank. They look at whether you have stocks, bonds, retirement accounts, and that kind of thing. Okay. So again, the purpose of today's presentation is to talk about Medicare. But if you do have questions about Medi-Cal, I can help answer those at the end. So, as I already mentioned, most people who are on Medicare because they are age 65 and older. Most people also qualify for automatic enrollment into Medicare as long as they receive a Social Security retirement check. Now, in order to be eligible for a Social Security retirement check, you need to have worked and paid into the Social Security system for a minimum of 10 years. So you need to have 40, at least 40 work credits. You need to have at least 40 work credits with Social Security in order to be eligible for a Social Security retirement check. Okay. And so if you are eligible for a Social Security retirement check, then you will automatically, you will be an automatic enrollee into Medicare. We're not going to focus too much today on the rules for people who are disabled. But if you have questions about that, please feel free to ask me at the end of the presentation. But today we're going to focus on people who are age 65 and older. Now, not everyone is eligible for a Social Security retirement check. Okay, some people just have not worked in the US or haven't had a job that pays into Social Security. So what happens to people who do not qualify for a Social Security retirement check? As long as you are over age 65 or older, and you are a US citizen or a legal permanent resident with a green card, and you have lived in the US continuously for at least 5 years, you can voluntarily enroll into Medicare. You can choose whether you want to enroll in the Medicare program. Now, there are also some residency requirements for Medicare. If you are a US citizen, there is no length of residency requirement. But if you're a lawful permanent resident or someone who is here in the US under temporary protected status, and if you qualify for free Part A because you have the work credits with Social Security, there's also no length of residency requirement. But if you are a lawful permanent resident and you don't qualify for free Part A, you would have to wait those 5 years to enroll or to apply for Medicare. Okay. Now, when are you supposed to enroll in Medicare? Medicare doesn't allow people to enroll whenever they feel like it. There are very strict enrollment periods. And the most important enrollment period is your initial enrollment period, right when you are going to turn 65. So the initial enrollment period starts 3 months before you turn 65. It includes your birthday month, and it continues for another 3 months after. So it's a total of 7 months. And everyone has a birthday at different times of the year. So that means everyone's initial enrollment period is different. It's based on your specific birthday. It's based on when you are turning 65. Okay? If you miss your initial enrollment period and you don't enroll in Medicare when you first turn 65, you can use the general enrollment period, which is every January through March. Okay. And then some people might qualify for a special enrollment period, especially people who are working and have insurance through their employer. But again, the most important takeaway is you don't want to miss your initial enrollment period when you first turn 65. And there is a little bit of information about what to do if you are working and you have employer insurance through your job. You may not have to enroll in Medicare right away. We won't get into the details of that today, but if you have questions, please feel free to ask me at the end of the presentation. So again, most people have to enroll in Medicare when they turn 65. But if you're working and you have employer insurance, you might be able to delay your enrollment into Medicare. Now, Medicare has 3 different parts. There's Part A, Part B, like boy, and Part D, like David. Part A is the hospital insurance with Medicare. And it actually covers more benefits aside from just hospital stays. It includes skilled nursing facility care, it includes home health care, and it includes hospice. Part B, like boy, is called medical insurance, and that's all your outpatient care. So if you need to go to the doctor, or if you need to go see a specialist, or if you need to go get labs or x-rays done, that is covered under Part B, like boy. So most people on a day-to-day basis are using Part B. They're not really using their Part A very often. It's usually the Part B that's more widely used because that's what covers doctors, specialists, labs. If you need medical equipment like a wheelchair or a walker, that's also covered under Part B, like boy. And then the third part of Medicare is Part D, like David, and that's the coverage for prescriptions or for medication. Now, if you are on Medicare, you do have access to some very important preventive benefits. Preventive benefits are services that are meant to screen for disease. So screen for breast cancer or cervical cancer or colon cancer. So if you are on Medicare, Medicare will pay for you to get a screening for those different types of cancers. And there are rules about how often you can get those screenings and how much they cost. But most of these preventive benefits are free. There's usually no copay for a lot of these preventive benefits because Medicare wants to make sure that people are staying as healthy as possible. And so one important preventive benefit that I want to make sure to mention, especially right now, is the COVID-19 vaccine. Medicare does cover the COVID-19 vaccine as well as the flu shot every year. And both of those are at no cost to you. Okay. Now, I want to go back to something I was discussing at the beginning, which has to do with eligibility for Medicare. So if you remember, I was saying that most people are automatic enrollees for Medicare. You're an automatic enrollee if you are eligible for a Social Security retirement check because you have worked and you have paid into the Social Security system here in the US. And if you are eligible for a Social Security check, you get to enroll in Medicare Part A hospital insurance for no monthly premium. That means there is no fee to be enrolled in Part A hospital insurance. But what happens if you don't have the work credits to qualify for free Part A? Again, you can voluntarily choose to enroll in Medicare, but you will have a very high, very expensive monthly premium or monthly fee for your Medicare Part A hospital insurance. So if you're able to look at the screen, you can see that Part A can be as expensive as $471 a month just to be enrolled. So it can be very inaccessible for some people. And in a moment, I will give you some information about a program that might be able to pay for your Part A if you don't qualify for free Part A on your own. The other thing I want to say about Part A hospital insurance is that the copays and deductibles that you have to pay if you go into the hospital or if you go into the nursing facility can be very, very high. And so sometimes people who are on Medicare really worry about how they're going to pay for their copays and deductibles if they were to be hospitalized or if they were to be admitted into a nursing home. So at the end of the presentation, I'll also give you some information about how to reduce some of these high out-of-pocket costs. Now, remember, the second part to Medicare is Part B, like boy. Part B is the part that most people use on a regular basis. Part B is the one that covers doctors, specialists, labs, and x-rays, things like that. And Part B does have a monthly premium, meaning there is a monthly fee you have to pay in order to be enrolled in Part B. The monthly premium this year is $148.50. Okay, some people pay more if they are very high income, but most people pay the standard $148.50. And usually this premium is deducted from your Social Security check every single month. So when you receive your Social Security retirement check in your bank account, they will already have taken out $148.50. And then once you start using your Part B services, if you go to the doctor, if you go to the specialist, if you go get labs or x-rays done, there are also copays that you have to worry about. And typically, what we say is that Medicare only covers 80% of the cost, and then you, the patient, would have to pay the other 20% as a copayment. Now, if you are low income and you have limited assets, meaning, you don't have much money saved in the bank, you don't have any stocks, bonds, or other retirement accounts and things like that, you might be able to qualify for the Medicare savings programs. There's 3 different programs, and these programs help to cover some of the Medicare expenses. The most important program that I want to mention today is a program called QMB, Q like Queen, M like Mary, B like boy. The QMB program is really important because it helps to pay the Part A monthly premium for people who don't qualify for free Part A because they don't have the work credits with Social Security. So if any of you are listening to me and are thinking about how you may not qualify for free Part A because you don't have work credits with Social Security, let me know if you have more questions about how the QMB program works. Again, this is the program for people who want help paying for Part A hospital insurance. And there's 2 other programs. The other 2 programs pay for the Part B monthly premium, which is $148.50 a month. Now, the third part to Medicare, like I said earlier, is Part D, like David. That's the prescription drug coverage through Medicare. And you may not have to enroll in Part D if you already receive prescription drug coverage from another source, like from an employer plan or something like that. But most people do have to enroll in Part D, because if you don't enroll in Part D on time when you first turn 65, you might be hit with a late enrollment penalty in the future. Now, if you're thinking about enrolling in Medicare Part D, which is prescription drug coverage, you have 2 options. The first option is Original Medicare with a prescription drug plan. And Original Medicare is really good for people who want to pick their own doctors, who want to see the doctors and specialists that they already have. It's really good for people who don't want to wait for referrals or authorizations. If you have Original Medicare, you can go anywhere that they accept Medicare. But Original Medicare can be very expensive because there are co-pays and deductibles. So the second option is to enroll in a Medicare Advantage plan. These plans are usually HMO plans, and you have to stay in their network. So if you're in a Medicare Advantage plan, you have to get all your Part A hospital, Part B medical, and Part D prescription drug coverage through that specific plan. So just to give you some examples that you may have heard of already, we have Kaiser Senior Advantage. That is an HMO for people who want their Medicare to be with Kaiser. We also have a company called Scan. We have another plan called Blue Shield 65 Plus. There's so many. There's a lot of different Medicare Advantage plans to select from. But be very, very careful when you are looking at a Medicare Advantage plan, because remember, it's an HMO. So you're only going to be able to go to their doctors, and you're going to have to wait for referrals to see specialists. and you're going to have to wait for authorizations for almost all of your services. So that's why some people just really don't like this option, the option called Medicare Advantage. But the good thing about these plans is that they can offer lower costs. So if you're really, really worried about saving as much money as possible, you might want to look at a Medicare Advantage plan instead of original Medicare with a prescription drug plan. And when can you enroll in a Medicare Part D plan? Well, you also have your initial enrollment period when you first turn 65. Remember, your initial enrollment period is the most important period. It's 3 months before your 65th birthday, your month of your 65th birthday, and then 3 months after. So you have 7 months total. And then every year we have Part D open enrollment. It's October 15th through December 7th. And everyone knows that it's open enrollment during October 15th through December 7th because there are so many commercials and advertisements on TV for all the different Medicare plans. Okay, so if you want to make a change to your coverage, you usually have to wait until open enrollment, which is in the fall, and then your new plan starts January 1st of the following year. And there are special circumstances that might allow you to make a change to your Medicare coverage throughout other times of the year. So for example, if you move to a new area, let's say you live in LA County right now, but let's say that you move up to San Francisco, or let's say that you move to Arizona or to San Diego. If you move to a new area, you will have to pick a new plan because these plans only work in very specific areas. Okay, so that's one example of a special circumstance that might allow you to make changes to your Medicare coverage, even though it's not open enrollment. And then we don't have to go into too much detail about this information, but just know that the prescription drug costs through Medicare can be very high. A lot of people, have difficulty paying for their medicine at the pharmacy. I talked to someone yesterday who told me that her insulin is $150 a month. And, again, we won't go into the details of how all of the costs work for prescription drug coverage, but just know that depending on how many prescriptions you take, whether they are generic or brand name prescriptions, your costs can be quite high. So there is one program that I want to mention today. It's called Extra Help. People also call it low income subsidy, but I'm just going to call it Extra Help. And this is a program that's available through Social Security, and it lowers your prescription copays. So when you go to the pharmacy, instead of charging you $150 for your insulin, they may only charge you $35, just as an example. There are different levels of help that you might qualify for depending on how high your income is. So if you're interested in applying for the Extra Help program because you need help lowering your prescription drug costs, please let me know. Our office can help you with the application. You heard me talk already about how expensive Medicare can be. Again, most people qualify for free Part A if they are eligible for a Social Security retirement check, but some people have to pay a premium for their Part A hospital insurance. Then there's the Part B premium, which is $148.50. Then we have co-payments and deductibles. Once you actually start using your insurance, the coverage isn't 100%. Medicare pays one part and then they ask you to pay the rest. So Medicare can be very expensive and the costs can really add up quite quickly. And on top of that, there are some important benefits that Medicare just does not cover. So people are surprised to find out that Medicare does not pay for dental services. Medicare doesn't pay for vision services. Medicare doesn't pay for hearing aids. Medicare doesn't pay for diapers. Medicare does not pay for transportation. And then, very importantly, Medicare does not pay for any care that you might need in your home. So if you need help with cooking or cleaning, or you need help bathing or using the toilet, unfortunately, Medicare does not pay for those types of services. So what can you do in order to help cover some of those costs and in order to get access to some of those important benefits that Medicare just doesn't cover? Well, you can think about supplementing your Medicare. One of the ways that we already talked about how you can lower your costs is by enrolling in a Medicare Advantage plan. Those are the HMO plans. A lot of those plans offer lower copays, and they sometimes offer extra benefits like dental care, like vision or eyeglasses or hearing aids. So that's one way you can supplement your Medicare and make sure that you're not going to pay too much for your healthcare services. But another really important way to supplement your Medicare, especially if you are low income, is to apply for the Medi-Cal program. Remember, Medi-Cal does look at your income and your assets when determining your eligibility. But if you are eligible for the Medi-Cal program, then you are known as a Medi-Medi because you have Medicare and you have Medi-Cal. So if you have both, then Medicare is your primary insurance and Medi-Cal is your secondary insurance. If you have Medi-Cal, the state of California will pay for your Medicare Part B premium so that they don't charge you for it. Remember, that's $148.50. Then on top of that, Medi-Cal pays your co-payments and deductibles. So if you go to the hospital or if you go to the doctor's office, you cannot be billed for your services because you have Medicare as your primary insurance and then you have Medi-Cal as your secondary insurance. And then the last thing with Medi-Cal is that you automatically qualify for extra help to lower your Part D prescription drug costs. So if you have Medicare and Medi-Cal, you cannot be charged more than $1.30 for your generic prescriptions. and no more than $4 for your brand name prescriptions. So again, if you have both Medicare and Medi-Cal, you do have a lot of assistance with all your medical expenses. And then the last thing I really wanted to share with you has to do with the topic of fraud. Unfortunately, in our office, we are seeing a lot of cases of fraud. This can be from doctors who are cheating the Medicare program out of money by charging for services that they never provided. Or it can also include sales agents and insurance agents that are enrolling people in plans that aren't good for them, or they are misrepresenting how the plans work and tricking people into enrolling with their plan. So you have to be very careful. If you are on Medicare, make sure you safeguard your Medicare information. Make sure you don't share your Medicare number with just anyone who calls you. And just be very careful and stay alert. There's always a lot of scams going around, especially right now relating to COVID-19. And again, here is our phone number. Please save it in a safe place. We are here to help answer questions you have about Medicare. If you also have Medi-Cal, we can also help you with any questions you might have about your Medi-Cal insurance. So let me just read out the phone number one more time. It's 1-800-824-0780. And so hopefully this has given you kind of an overview of Medicare. Okay, so who's eligible? When can you enroll? What are the different parts? And what coverage options you have. And I do think we have plenty of time for questions. Thank you.